guys, what's up? It's me, Brooke here. Today I'm going to be talking about how to make a care plan and how to organize it, and most importantly, what I use to help me with my care plans. First off, let me begin by saying for this video, I'm not going to show you like how to do a nursing diagnosis and all that stuff. Hopefully you already know how to do a nursing diagnosis. But I'm going to show you these tools will pretty much help you with nursing diagnosis and stuff. So hopefully you already have some background information and background knowledge of what that stuff is. And another important I guess, side note would be every nursing program, care plans, or sometimes they're called concept maps, care plans, concept maps, pretty much the same thing. Every program is different on how they do theirs and what they use and what format they use, so keep that in mind as you're watching this. So what is a care plan / concept maps? Well, for us, we have to do for the semester, I think we only have to do like 2, and so it's basically an overall plan of care for your patients, and like we have to turn it in and we get graded on it. So it's just basically just a plan. It's called a care plan. It's just the overall summarization of what you're going to do for your patient. And ours is like 8 or 9 pages, and a lot of people freak out when they see that. Like, oh my gosh, I don't know what to do. How do I do it? So I'm just going to guide y'all through it. It's really not that hard. It takes time. It's kind of like busy work time. You need to make sure you have it printed out when you go to your clinical. That way that can help you, or you can fill some stuff out while you're at your clinical and try to gather as much information you can about your patient while you're at your clinical, so you can obviously remember it, so that way you can do your map, concept map or care plan that day or whenever you want to do it. So you need to make sure you have all the information that you need for your patient. So I bring mine with me to the clinical and get all the lab values and blah blah blah. Okay, so this is what kind of ours looks like, but everyone's is different. So everyone has a different format of what their nursing program has. And I'm going to show you what I use for this. Okay, so I use this thing. It is called a Nurse's Pocket Guide. It's a 14th edition. It's diagnosis, prioritize interventions, and rationales. And this thing helps me get through the care plans. Like, it makes it very easy, more smoothly, and takes less time if you have this. And then another thing I use is, we're required to get this for our pharm class. It's a, and I still have it from pharm, it's a nursing drug reference, and this helps me with the medications that my patients are on for the medication section for the care plan. So I'll show you all about that in a minute, and this is very helpful. Okay, so the first thing, the front page, a lot of people freak out when they see this, and I guess all I can say about this is get as much information you can for your patient. Like for the lab studies, you're not going to write down all the labs that your patient has. You're just going to write the abnormal values. So let's just say you have a patient's, you see their bun and it's like 40. Well, the normal bun is 7 to 22. So that's abnormal. You're just going to write the abnormal. So you're going to write the bun because it's abnormal. So only write down the abnormal ranges, and then you can do and then it has a place for patient values and normal ranges. So it's on this side. So write that stuff down. And then the main thing to remember, and everything else is pretty self-explanatory on the first page, everything to remember is just don't leave anything blank. If you don't have information, you don't have to make it up, obviously, if you don't have the information. So you can just write NA. So try not to leave anything blank. And then this page. And this page is pretty self-explanatory, so I'm not going to talk about that. It's pretty easy. And then for this, obviously in the middle you would write the diagnosis, like what the patient actually has, the medical diagnosis. And these are a list of potential nursing diagnoses. So you're like, okay, where do you get these nursing diagnoses from? This book literally has everything in it, so get it. Whatever your patient has, you can just go to the table of contents and you look to see what your patient has. And let's just say you want to do a nursing diagnosis of activity intolerance. So you go to the page number. Let's see. Boom. Activity intolerance. It even has the related to and the related factors, which is the related to. So you would write activity tolerance, related to, and then it has options that you can choose from. This one you can choose general weakness, and then it has as evidenced by, and the as evidenced by is the defining characteristics, the subjective data and the objective data. So boom, you have those, and you can pick 8 different nursing diagnoses. So boom, you're done with that. And you would just write down here, and then you would prioritize them, choose your top 4, and then you can just do, and then I would write some of the signs and symptoms on the down here too for each of the 4 nursing diagnoses. So make sure you write the signs and symptoms, not just, don't get lazy and forget the evidence by. And everything else is pretty self-explanatory. For these, the book has everything. It even has the rationales. The only thing it doesn't have is the patient's response, because it doesn't know how your patient responded to those interventions that you did, but that's pretty easy. And it doesn't have the goal and outcome, and those are also pretty easy. So like mine, it says like anticipated goal, promote, maintain / maintain / prevent. So you just choose one. So you can do like maintain, or let's see, prevent falls. That's a goal. And then an outcome, depending on your nursing diagnosis or whatever, you just need to make sure your outcome is measurable and realistic. So you need to be like, so for in this book, the outcomes, they're not really measurable, so you need to add up on that. So you need to be like, just a random example. Patient will ambulate by the end of the shift, or patient will, I'm trying to think off the top of my head. Oh, patient will verbalize signs, symptoms of his condition by the end of discharge. So it just needs to be realistic and measurable, okay? So make sure you keep that in mind, because these don't have measurable goals. But other than that, you can use the, obviously the diagnosis, the interventions and the rationales. And then when it says actual goal not met or met, you would say if they met the goal, they didn't meet the goal, and why didn't they? And you don't have to use the book for that. It's not in the book. It's just common sense. What happened, it's what the results, with your patient. And then that's pretty much it. Then the last page. Oh, the last page. Medications. So what medications was your patient on? And that's when this drug book that I was telling you comes in handy. It literally has pretty much every drug in it. You can do like, it has a generic name and brand name, and it will tell you the action and the uses for it, and it will tell you the side effects, contradictions, dosages and routes, and nursing considerations. It'll tell you what to assess and what to teach the patient and their family. And that's all you need. Look for that. You just need the generic and brand name, rationale for giving this med. So why are you giving this med? Patient teaching and nursing assessment. And it's all in this drug book. So don't freak out about the care plans. Use your resources, use these, and that's all you need for them. And like I said, the main thing is don't leave anything blank. If you don't know, write in A. And yeah, just use your resources. Another resource I have found that kind of helps me too is online. I believe it's called nurselabs.com. I will find the link and I will put it in the description box for you guys. So yeah, that's how you do a concept map / care plan. Don't freak out. Just do it. It just takes some time. It's not bad. Use your resources. Give this video a thumbs up. Follow me on Instagram, Brooke Thompson 18, and subscribe. I'll see y'all later.